Here's a question for you. If someone has a medical emergency, someone you loved, are you prepared? Mercy Health's Dr. Nick Sauber is here with us to talk about why it's important to know the basics. You know, I took CPR in Boy Scouts. That was a long time ago, Doc, and a lot of us may get some training at some point in our lives, but unless you were military or EMT or in the medical field, you probably would have forgotten a lot of things over the years. But yet, when we have a medical emergency, you've got to know these things or someone's going to lose their life.
Right. The community resiliency programs that we've developed with hands-only CPR, basic Heimlich maneuver, stop the bleed, those kind of things just amplify all of the other medical knowledge we know, so we get it out into the hands of the community. You know, EMS shoots for 8 minutes from the time of a 911 call to get there. That's a long time. Hopefully we never have to use this, but the studies are showing that people that have that training are significantly more likely to jump in when they see that. And that can be at home, at work, at church, at a concert, any of those places where people need to know how to use things like AEDs, the automated defibrillators, which we know that the sooner we get that on, the faster we can get someone back into a heart rhythm that is going to pump blood and save a life.
Well, numbers here, only 51% of Americans think they would be able to perform hands-on CPR to help someone. Only 49% feel they could step in and staunch serious bleeding. 56% said they could help someone who's choking to death. A lot of us got, know to get around the, but still, that's not very impressive. I mean, and we're talking about lives lost here because somebody freezes. But like, if someone collapses, I don't know, should I try CPR? Should I grab that AED thing? I don't know that that's going to help them. How do you know what circumstances unless you have some medical training?
Right. And the answer is yes to both of those. If someone's not conscious, not breathing, start CPR. Right. We found that, we spend a lot of time checking for pulses. We're delaying that. Putting the AED on, if a shock is advised, it'll tell you. It actually talks to you and walk you through the whole thing.
The AED, the machine does?
Right. But it's just knowing where that is, wherever you are, taking note when you're at a concert or a ball game or school, knowing where those are and sending someone to get those. And all of that is covered in basic CPR training. And that can be a few hours. We found that people don't want to put their mouths on other people to give them mouth to mouth. So they did studies on hands-only CPR, and we found that's pretty effective. Especially, it's more effective if somebody won't start CPR because they don't want to put their mouth on a stranger. But people are more likely to do the hands-only CPR if it's pushing hard.
That's the chest compressions?
Right. Yep, pushing hard and pushing fast on the center of someone's chest until EMS arrives.
And what is that doing when you're doing that? What is happening physically when you're pushing on someone's chest to enhance their ability to recover?
Yeah, so the heart fills with blood passively. So the veins all dump into the heart, and then it squeezes that blood out. So when the heart stops, the blood's still pooling in there, but there's nothing to squeeze it forward. So there's some one-way valves within the heart and within the vascular system. So if you start pushing, after about 30 seconds or so, you can start actually moving circulation, moving blood to your brain, your heart, all your other vital organs, and that buys time for someone to get an AED, for 911, to fire and EMS and law enforcement there to bring that higher level of care. So once they start using the medications and all the other things that they do that they train years for to restart the heart or treat whatever the underlying condition is, but we can buy that time, and that's really what we're looking for, is those seconds to minutes things like stopping life-threatening bleeding with simple direct pressure, applying a tourniquet and knowing how to do that. Choking. I've been doing this for quite a while, and just the other day, my daughter choked on a grape. I was out in the garage, and she came out, couldn't breathe, and I hadn't done that before, but I did the Heimlich, and it came up, and we all took a very deep breath, and I'm so thankful for that. But it only takes a second for an emergency to happen, and having that training and updating that training, if you haven't had it since Boy Scouts, you're getting a refresher, reminder of what to do. You feel more comfortable and you're more likely to act and more likely to save a life.
We have about 15 seconds left. I want to let everybody know if you're interested in learning more about some of these programs, there's Emergency Medical Services Division with Mercy Health, 419-251-4706, and they can direct you, by calling that number, they can direct you to some classes, some sessions that will help you perhaps save a life, save a loved one, something really, really important. Nick, thank you so much for coming in. Appreciate it.
Appreciate it.